So one of the commonest approaches I get from students is they think there's some sort of trick or high yield that I can teach you. There isn't. There's no trick, there's no gimmick, there's no easy way to do this. Clinical medicine is built on a foundation of basic medical sciences. Today, I want to talk to you about how do you get through that initial barrier of starting to learn when learning is so uncomfortable. But before we get started, if you haven't already, be sure to subscribe. Every week, I post a video like this, which emphasizes how do you go about learning medicine. I'm Dr. Tisdall. I've been practicing medicine for decades. In my later years, I've started teaching extensively. I've got over a decade's experience now. Come and learn from the lessons I've learned. So we're up to about number 40 in our podcasts. And you've got to understand, for someone from my generation, we didn't even know what a podcast was 5 years ago. The reason I bring that up is we follow your interest in them really closely because we're all inventing the world as we go forward. We all get podcasts as entertainment. What we don't know is how do we use podcasts to create interest so someone comes and learns an education. So we follow them. We follow you. We follow which podcasts engage you and which ones don't. And this pattern has emerged. The podcasts that engage you the most are the ones in which I say, so how are you feeling? Because, of course, the answer is usually not very happy. The second podcast that you like is when it looks like we're doing tricks or easy ways to how to think about a multiple choice question. But the podcasts that get the least engagement are the ones when I show you techniques for learning. And the reason I'm thinking about this is we just did a detailed podcast on how to think about HPV infections. And I use this as an example of what mastery feels like, because it's hard to teach infectious disease. And I was teaching a student once who was a good student, and I kept asking questions that they should have been able to answer, I thought, and could not. And I finally believed that the problem was in how we had been teaching it. And so I've moved to this really different idea on how to teach infectious disease, which is you got to do it from the perspective of the organism, and then the pathology of the infection, and then a totally third circle on how does a doctor appreciate that. So I was showing you how to think about that with HPV and how a really important foundational disease requires a lot of basic sciences. So in the video, I talked about how HPV, you've got to understand the virus, you've got to understand histology, you've got to understand neoplasia, meaning there's molecular involved, and you have to understand the immune response. And I got to tell you, I'm kind of proud of the talk. I mean, I had to teach myself a lot about it because most of it's new information. Terrible engagement. And so, we were talking about why is that not getting the engagement? And this is my theory, and please weigh in if it's not true. I think it's because it requires a lot of mental effort. And I think that when you're out on the web looking for help, it's really much easier to say, I want the trick. I want a mnemonic. I want an easy way to do this. Well, here's the bad news. There is no easy way. And this is how I raise all of my students and all of my children. Learning hurts. Knowing is fun. There's no easy way to learn it. Performance equals talent times effort times directed effort squared. But you notice there's two efforts in there. And so if you think you're going to come to me and I'm going to show you an easy way to do this, I'm not your guy. There's no easy way to do this that I know. What I am telling you, though, is if you put in the effort, you will be rewarded. The difference for us is I'm telling you the directed effort. If you learn this the way I'm teaching you, you will be extraordinarily powerful. It will translate into your patient care and your clerkship, and it will translate into your exam because the national exams are good exams. They're not trying to trick you. They're basically saying these are the 100 important diseases and the 100 important concepts. Do you know them? So, I can predict what's going to be on your exam. It's going to be the obvious. It's going to be important diseases, important disease mechanisms, and that's got to be learned. But again, effort times directed effort squared. learning the right things the right way is much better than just taking first aid and trying to learn it. So when I did my HPV lecture, here's what I'm going to challenge you. Go back and look at it again. Can you do the histology of a squamous epithelium? Can you come in and tell me why viruses are tissue tropic? Because when you have that basic science, you can then say, so what would the molecular basis that transitions a wart to become a squamous cell carcinoma? Because when you've mastered all that, then we can come and talk about you seeing a patient. How do you screen for this disease? Should you be doing the effects of the infection, meaning pap smears, or should you be actually looking for the organism? You got to know natural history. And then we get into the huge idea of how do we vaccinate? The vaccines are changing. The rules of the vaccines are changing. You've got to understand the virus and its immunogenicity to participate in that discussion. And now we get to add in the biggest barrier to the vaccines, which is psychosocial cultural. But we can't go to the fun part, which is who should get vaccinated, if you don't have your basic sciences, and that hurts to learn. Once you know it, it's fun to participate. And as an engineer said when I talked about medicine being hard, he said, how hard can it be? There's no math. And I have to admit, that got a really good laugh and we all really agreed with it. Medicine isn't hard, it's long. But you have to put that effort in. Let's talk about what I mean by directed effort. So in my med school, I've got a number of students that I've met and enjoyed in first year, now coming into second year. They haven't quite started yet. It's in a couple of weeks. And they wanted to get a head start because they know it's a really busy year and they're going to get overwhelmed almost immediately. And they're starting with heart. So one of them, I said, go read the chapters in the book. Start with chapter 15, which is structure function. Good student, really tried hard. He pinged me and said, I've read the chapters. Let's see what I learned. And I started, no kidding, with the first image, which is, how do you think about the thorax? And the answer is the chest x-ray and T6 in the CT scan. And so I just drew out my chest x-ray and he couldn't do any of it. And it's really hard not to be a boomer and sort of go, well, I'm back in the day. But a little part of me said, how could this good student have been assigned this image and not have even seen it? And I think it goes to, what do we mean by directed effort squared? Because I promise you, he obviously was embarrassed. I mean, it's the first picture in the first page. But I sat down and we went through it. Now, I'm willing to bet when I see him this week, he's going to know it perfectly and he's going to be able to use it. So when we talk about what is effort squared, it means I will assign it to you, and I don't mean this meanly. You probably won't do it based on what I see with my students. However, when you then come and I tutor you in it, oh, by the way, I'm not kidding, this matters and this is why it matters, you will learn it. And that's kind of what we're looking for in our community, right? It's very hard to be given a dry picture and say, learn it. That doesn't work, right? It doesn't work. We talk about this a lot. But the second I say to you, I can't go on in heart disease if you can't do the underlying structure of the thorax, well, then you'll learn it, won't you? So that's what we want out of the community. We're learning how to teach you. You have to give us feedback on how well is that working. And one of the things I think is inevitable is you do need someone live to look at you and say, tell me what you learned. So it's not as simple as me saying, go learn this. That actually doesn't work very well. It's me saying, go learn this, and then talking to you about it and you finding out you actually didn't learn it very well. But now you know how to learn it because you've been through it once. So we'll come back to this idea. We use medicine to teach you how to learn medicine. And when you come to the community, my bet is after we do this for heart and then lung and then kidney, I'll bet by the time we get into the next organs, joint and bone, my bet is you have a much better sense of how to teach yourself. But you know, the community's new. Come and teach us to teach, and we'll teach you how to learn. If you're ready to start the process of learning medicine, the textbook is ready for purchase. You can click the link in the description. But remember, that's just where the learning starts. You have to come to the community using the book to learn how to learn medicine. The community is up and running. Every week, I'm going live and we're teaching medicine. Come and join the other students who are having this live tutoring experience. For more information, please visit drphiliptisdall.com. See you next time.